We want to bring life and health to Yamatonga. This is what the people cried out for. This is what they said was their biggest need, and it's the aim of the Cedar Foundation working together with the government and the local council to bring a sustainable health centre that gives quality care. We came to Kamanga in Yamatonga about 3 years ago now. We are treating about 1,000 patients a month. We have roughly between 30 to 50 births a month, so I guess that's about 1.5 a day. So one of the things we wanted to focus on is we really wanted to make sure that our lab work was efficient and exact. Whoever is coming to the health centre as a patient can rest assured that actually what they're being diagnosed with they actually have. We've deliberately made the health centre put as much effort as we can into making the health centre a beautiful place. We want to take care of people. We want to make sure they know that they are loved, that they're going to be looked after, that they will be treated with respect, that they are valued.
One evening when I was walking home from a wedding, I was attacked and robbed. I thanked God when I arrived at the Kamanga Health Centre and found such caring people there to receive me. I was in a very serious condition. They promptly stopped the bleeding, fixed my broken arm and stitched my head. It is the best and fastest health service available, and I truly thank God.
So at the health centre here we look to take a holistic approach. That means we not only treat people here, but we also do prevention. That's part of our community-based rehabilitation. So Jackie and Nema every day head out on their motorbikes and they travel around the whole ward of Yamatonga and they visit people and bring medical care to them.
Firstly, I'm so very thankful to you all. I have leprosy. Now that the CBR has visited me, they have treated me, I feel a lot better. My husband is blind, so I can't just sit at home all day and rest. What will the kids eat? I have to support my family.
One of the big problems we have is we are on the power grid, but unfortunately electricity is very sporadic here. It happens that sometimes we have outages, power losses for 4 to 8 hours. Then we have to use our backup, which is a generator. Our generator is fueled by diesel and this becomes very expensive. But we felt now that we're using so much diesel that the most sustainable way to address this is to convert to solar energy. It gets dark here quite early, so you can imagine we have ladies who are trying to deliver their babies using literally our phones to bring light to it, or if people come in with serious injuries where there's bleeding or there's bones broken, you can imagine how difficult it is to get all the departments working, get into the laboratory, get into the pharmacy, look at people in any way that's useful if you're using lights from a phone.
Recently there was a bus crash in the night, so they came in 30 people and they have to operate without light, stitching and doing things, so that was really difficult.
The difference it would make here if we didn't have to turn on the generator in order to look after emergencies in particular, and if we had solar power we could use it all the time because of the beautiful climate we have here. The batteries in the panels would be constantly recharged, so we would love to use solar power.